we have Dr. Jordan Seltzer, who has been behind the scenes all day helping put this on, but he is a graduate of the GW program, and so I thought it'd be appropriate for him to introduce Dr. Pai.
Yeah, so thank you, everyone. I was also the voice of the intensive care doctor, if you recognize my voice. But so Dr. Pai is going to be giving a talk. He is faculty at GW here. He's had an incredibly interesting career, he's former FBI agent, and he's going to tell us a little bit more about his perspectives.
Hello? Yep. Great. I think you guys already met quite a few of our amazing, interesting, and talented faculty today. My claim to fame, I worked for the Federal Bureau of Investigation for 20 years. In 1997, I joined the FBI as a special agent. Because my computer science background and my previous work experience at IBM cybersecurity, they have me work both healthcare fraud and also national security cyber threat. And eventually, I actually got pretty good at it. Eventually, they promoted me to headquarters FBI cyber division as a unit chief, and where I was the manager for national threat. Let's see. Nope. Okay. Yeah. Where I managed an advanced persistent threat, and I was also the unit chief for a bureau program called InfoGuard. I don't know if people are familiar with it. It's a public-private sector partnership between the FBI and all the 16 critical infrastructure sectors. I was the unit chief in charge of the program. And matter of fact, the next speaker, John Luigi, and I were both in the cyber division together, and he was my section chief, actually. So it's actually a lot of fun today to be here and have a chance to talk to everyone. After I retired from the bureau, I worked as a chief medical officer at a federal contractor facility where we basically develop IT systems for CDC, NIH, HRSA, FDA in terms of the healthcare and public health IT systems. So this is the my primary experience on that cybersecurity front. Today, I'm going to talk about cybersecurity on the healthcare setting, but I'm going to talk about at a foundation level. Okay, I'm not going to talk about budgets. I'm not going to talk about politics. And the stuff I'm going to talk about is at the foundational tactical level. And hopefully, this is something that at the government agency they could possibly use. But more importantly, that if you're in the private sector, if you're a corporate, if you're a hospital, if you're the CISO, this is something you can take home with you. The four main topics I'm going to talk about today, the first one is lessons learned from COVID-19 as part of that entire pandemic response. And I'm going to talk about some of the clinical things that we did, but actually channel that to see what kind of lessons learned we can take from COVID-19 pandemic in applying to cybersecurity. I will talk about risk, but when I talk about risk, all I'm doing is using that as a framework to talk about how we can approach cybersecurity in a proactive fashion. And then I will talk about a concept of whole of nation in privacy and security. Okay, these are some of the basic topics I want to cover today. So first of all, lessons learned from COVID-19. We weren't prepared for COVID-19. From disaster management point of view, COVID-19, it's a rare event with a very, very high impact. Okay, from disaster management, we all know these are the situations that are that's the most difficult to prepare. Anything that's high frequency, high impact, like structure fire. We're pretty good at doing that. high frequency, low impact, bumper to bumper accident. We're pretty good at handling that, okay? But it's that, you know, and then you have that low frequency, low impact, you know, if you step on doggy poop, oh, well, you know, so, and then you're not gonna spend $1 million in manpower to prevent that. But the most difficult one is COVID-19, okay? But the lessons learned here is that I think there are still believers out there that what's the chance of a cyber compromise going to happen at my company? It's almost, you know, the COVID-19 is almost like a sci-fi. Prior to November 2019, how many people will imagine that now we need to go to the grocery store, we need to go to the mall and wear a mask? Everybody's doing that now. It's a norm. But prior to November 2019, right? This is like post-apocalypse. I mean, what we're doing right now, it's unimaginable. The other thing we learned from COVID-19 is that you cannot manage a prolonged large-scale disaster top-down, okay? There's no reasonable expectation that the federal government can control this type of a disaster at the federal government level. There's no single federal agency is capable of doing that. You can collect the entire federal government, okay? But we still need to do that whole nation response, the whole nation response in order to respond to this properly, okay? For example, that COVID test. Do you remember when we first started that COVID-19? Only the very specialized laboratories in clinical labs, they were able to do COVID-19. So, you know, majority of people couldn't even get COVID-19 if they had the symptoms. Later on, the technology got better. We got PCR tests, but then they can only go to certain, you know, urgent care, public health pots, and you know, hospital affiliated facilities. And then you get all these like long lines. Do you guys remember that? Waiting to get just a test. But now with like COVID test.gov, now the federal government is pushing those tests directly to home, okay? Not a perfect solution. I think clinically, a lot of times we're still thinking, the patient will ask, you know, what does it mean when I have a negative test, right? Because they are potentially false negative. There's still some interpretation that needs to be done. But the point here is that you cannot manage a prolonged large-scale disaster top-down. And then the other aspect we learned is that you must know your assets. Do you guys remember the time when the vaccine coming out in the locality, they're crying, says, we don't have any vaccine. Where are they? While there's some localities say, hey, our vaccine's about to expire. Let's get more people here. So you gotta know how many, what, who has it, and where they are, okay? It's same thing in cybersecurity, right? You gotta know your assets, which we're going to talk about a little bit later as well, okay? It's not just the physical assets, it's also your so-called carbon unit, the people, the readiness. You gotta know their vaccination status. This is actually what GW is using, right? ClearMe. So they know your vaccination status, that you can show up and show them, and that, hey, I got my vaccination. In matter of fact, technology does help in a lot of different ways in this kind of large-scale national disasters. It can be a geolocation service with a big data collection. You can do contact tracing through that. And or you can use, like recently, Virginia Department of Health, they push out this thing called COVID-WISE. It's using Bluetooth technology to identify proximities. And they kept the basic thing keeps this data for 14 days. And if the people around you, that's part of the program before they got COVID-19, you will actually alert you that you were in that close proximity to that person, okay? So the technology can potentially help. Now, let's take that and talk directly about cybersecurity. And I want to look at cybersecurity in that proactive fashion. When I say risk for this particular presentation, I'm talking about that proactive approach versus issue. Issue is some kind of adverse event that already happened. In that, now we need to do that root cause analysis. Now we need to figure out what's the mitigation we need to do, and what are the process, policies, and training that we need to do to prevent future occurrence. Risk is more the way I define it is that it's a uncertain event that has not yet happened. Okay, so for cybersecurity, and then the way I'm going to present this is using the foundational the risk assessment, and we'll go through them together. So cybersecurity risk can be probability times impact. If you have no impact, okay, if that particular event or assets really is meaningless, you have a very low risk, regardless of your probability. However, the probability for cybersecurity can be further expanded to vulnerability and threat. Okay, and I want everybody to look at threat. Threat, it's the most important component here. Okay, cybersecurity, we shouldn't be just compliance-based. We need to be, how do we assign priority to it? It should be threat-based. Okay, if you have no threat on certain vulnerability, okay, like we talked about earlier, you can fix all the vulnerability you want, but if that particular vulnerability and there's no threat to address it, you're just wasting time. Okay, so when there is a high threat, what do? We need to decrease the vulnerability. We need to decrease impact, and this is exactly the mitigation we need to do. Okay, and let's take through vulnerability, threat, and impact from a policy point of view, a very foundational policy point of view. Okay, just a couple good points on each one. As a critical infrastructure sector, healthcare and public health, we're not very good in cybersecurity. Okay, compared to some of the other sectors. Like, we'll be honest with ourselves. The one that actually do a very, very good job is probably financial and defense industrial base, right? Okay, but why isn't that healthcare up on par with financial and defense industrial base? So if you want the healthcare sector to have the most robust cybersecurity, we have to understand what are the intrinsic vulnerability, the context and issue within healthcare and public health. Okay, so I'll give you a very good example. Where is the computer terminal in a bank? They're behind those bulletproof glasses, right? What's the chance you get your hands on that? Not likely, right? Where are the computers in a hospital? Patient room, examination room. It can be a doctor station. But I would just pick the examination room as an example, right? The computers in the examination room, so the doctor can view the X-ray, look in the labs, do the documentation for history and physical, okay? For a computer, so anyone who actually understands how to do a computer intrusion, this is a dream come true. You have a room that's private, right? Because the patient needs to undress, okay? And then I have physical access to that computer. It's a dream come true. Even if the entire hard drive is encrypted, I can put in a thumb drive. I can boot it using the thumb drive and get access, or I can put in a key logger and then get account ID and passwords and again, access to other networks, okay? So this is the type of a specific context if you understand how the healthcare in public health may be different from the other sectors. This is when the ISO, ISAC, the specific sector-specific committee become very useful because they can help you define what's unique within the healthcare and public health. Okay. The other thing I want to emphasize within vulnerability is that we need to stop doing the binary thinking. I know CEOs and the department chair and people want to know why is our system secure or not secure. I mean, how do you answer that? There's no such a thing as secure system. There's always a 0 day. I can tell you, there's always a 0 day out there. That's why Microsoft, they have that regular patch and updates, right? It's a continuous dynamic process. It's never static. Okay, what we need to do is that push beyond to just say secure or not secure. We definitely want our system network to be hardened and fortified. Okay, but the other aspect we need to start looking at is the resilience. Okay, when an intrusion does occur, do we have the resiliency to identify what happened? Do we have the capability to survive that attack? Do we have the resiliency to rapidly recover with the minimal amount of data loss and then the time loss? Okay, that's that other side of the equation we need to start focusing on. Now, going to threat, I think there's a couple interesting points. We gotta understand who's our opponent. And the most challenging opponents are APT. So if I have a take-home message on APT is that just because you're not FDA, just because you're not one of those major government agencies, it does not mean you are not a target. Okay, APT, they will go for the weakest link to get to their target. Okay, the weakest links may be subcontractors, right? Or it could be you being individuals. So this is how they can escalate their privileges. But the advanced persistent threats are typically referring to foreign national actors. These are professional guys. They're full-time employee of military intelligence unit. This is all they do all day is figure a way out to compromise other people's system so they can gain information and gain control of them. And it's kind of funny within this APT community. They all have their little special characters. It's actually kind of comical, within the Bureau working these cyber cases. They have their own very interesting personality. Russian, okay? They kind of call them loud and dirty just because a lot of times Russian government actors are tied to organized crime. They would do anything for money, okay? They will actually conduct criminal activities, intellectual theft, industrial espionage for private company just to get money, okay? Chinese on other sides, very quiet. They're quiet professionals, highly organized, highly bureaucratic. You can almost see the signature. They basically, it's a 9-to-5 job, and then you see a dipping activity during lunchtime. Okay, their structure is highly, highly organized. They have their foundational units that does the intrusion with a subset of all the tools they have. Okay, and then they have the advanced unit who has far more access to the 0 days and other weaponized malware intrusion tools. So they can call in the cavalries depending on the difficulty they have. Highly, highly organized. However, the Chinese actors can also compromise commercials, especially they will do that for enterprises that are tied to the government, or they may be affiliated with like high party government officials. Okay. And the other aspect on threat that we have to understand is that supply chain risk management. Okay, very, very important concept. And even though the AppSec here is not really like a true insider threat, okay, but here's the concept I want everybody to understand. AppSec is referring to application security. Nowadays, our system is so complex. It's highly unlikely you have a fully independent system that does not depend on any third-party applications. There could be codes, dependency on a third-party application. When you do that security assessment, you cannot just do it on your own system, the code. You also have to do the full assessment on these third-party application that's either embedded or it depends on. Okay, again, the cyber intrusion, those APT guys, they're gonna go for the weakest link to get to where they need to be. Okay, impact. If if a CISO comes to you says that last week, my firewall detected and deterred 500 intrusion. Okay, another CISO come over and says, "Hey boss, our firewall we detected and deterred 10 intrusions." Okay, I want you to think, who's the better CISO here? Who has a better system? Okay, you don't have to answer, but think about it. Who's the better CISO? There's actually no right or wrong answer. The answer here is how it depends. I love it when Jessica and earlier they were doing their fireside show. They say it depends, and when I teach medical students, I love teaching them it depends. I tell them if a attending physician ever pimp you about a case, about a patient, you say it depends. Because when you say it depends, it shows that you have an in-depth understanding of the question they just asked you. Your brain is looking at the different contexts, the different alternatives and options. Okay, you will look really, really smart when you say it depends. However, what's difficult is that you got to come up what it depends on after that. Okay, so I will give you the problem with the number, again, using a clinical example, which is kind of fun because I'm the medical doctor here. So a respiratory rate of 12, right? Normal, everybody here is breathing about like between 10 and 14. So when someone says that, my patient has a respiratory 12, does that mean we have a normal, healthy patient? It depends, right? It depends. Okay, if the patient is an asthma patient that has been, breathing at a rate of 40 and 50 in the last 48 hours, okay, now he's looking bluish and breathing at a rate of 12. You know what that means? He's tired, he's crashing, he's dying. The guy, so same thing, an exact objective quantitative number. If you don't understand the context behind it, okay, that number means nothing. This is the part I think earlier we're talking about. You need to build that full business case. You can't just have a number, but you gotta have that entire context and the full understanding of what that number means. Okay, so here, I would say that even though the guy that the CISO that detected 500 sounds far better than the guy with the 10, okay, but if the CISO with the only 10, he has the excellent, outstanding attack surface management, meaning that this guy knows every assets, software network, and now his assets have their butt hang out on the internet, external facing, and then he has minimized all his footprint that other people cannot see or touch. Okay, that could be a better system. That could be a better security we have. So it depends. The concept I do want to introduce here is the whole of nation. Here we're talking about collaboration. Okay, the collaboration here has to be government all the way down to company, public, private sectors, all the way down to individuals. And not just that, it has to be sector, cross-sector, and then within a sector, the subsectors. There's always interdependency. If I just pick the 16 critical infrastructure sector, health care and public health depends on what? Emergency services, communication, energy, right? Chemical for pharmaceuticals. Okay, it depends on many other type of sector. If all you focus one sector and then you don't cover the other cross dependency, you are going to fail. And there's also other issues with jurisdiction. For example, it could be a physical, geographical jurisdiction. It can be a local, county, state, federal, or to make things more complicated, just at the federal government level, it can be statutory jurisdiction. You can have a Title 50 with the military, who may not talk to Title 18 with the FBI, DHS, or Title 10 with the Intel services. But the APT folks don't care. They don't care what's your physical, geographical, or statutory, right? And so in order for us to defend ourselves, we cannot compartmentalize those practices. And so that goes with the concept of decentralized governance. I do want to point out that within the human health services, there is an organization called Office of National Coordinator. Actually, they do a very good job in setting standards for health IT system in terms of interoperability. They do certification for health IT systems, and they also even provide testing tools to help people to meet those certifications. Okay. The other aspect here is data management. Okay. We do want to decentralize, but the data need to be centralized. The information needs to flow from individual company to local, county, state, all the way to federal into this big pool where everybody can use. And from top down, we need to do, the federal government need to declassify those information. Any kind of critical information, they need to declassify that down all the way down to individual, okay? And the last part I want to talk about is the privacy and security, okay? Yes, a lot of times cybersecurity does have a trade-off. Security versus performance. If I'm going to encrypt my hard drive at rest, it's going to eat up some CPU when you pull the information. Security versus convenience. Password is the perfect example. Okay, if you have a long 60 character completely randomized, different one for different account. Great for security, but it sucks for convenience. Okay, security versus privacy though, very, very important. I know this is a very sensitive topic. Okay, but there is a difference here. Security and privacy in terms of government surveillance, yes, there could be a trade-off. In some countries, they have a camera on every intersection street. If their accident occurred, if a crime occurred, they can look at the videotape and do the investigation, find out exactly who's responsible for it, okay? But whether that's acceptable as a privacy, it kind of depends on that particular culture in the country. However, we want to make a distinction between a technical implementation. In terms of technical implementation, security and privacy does not need to be a trade-off. Okay, a perfect example is actually blockchain. Earlier last year, I actually did a presentation on blockchain with Dr. Schwartz with the FDA. But I look at blockchain as an interesting technology that can promote privacy and security and trust to criminals, right? Blockchain initially was the backbone for Bitcoin, where the darknet folks are selling illegal services and products. And if you can get these criminals who doesn't even trust their mom and to throw their money into this particular framework, then it's a system that actually maximize both security and privacy. But it's not just the blockchain. Blockchain only offer you immutability and auditability, but it's the clever combination of using smart contracts, certificate authority, consensus algorithm, and API. You put all these different technology together, and then now you have this system that actually is able to achieve both security and privacy. Okay, so this is my primary presentation. I hope it was interesting, and that it does provide a foundational view of how that policy perspective for healthcare health IT systems.
Thank you so much.